Cefazolin, Ancef uses, dosage instructions and side effects. Cefazolin is an antibiotic in the cephalosporin family. It kills bacteria quickly and safely. Doctors use it to treat infections of the skin, bones, joints, lungs, and urinary tract. It's also given before surgery to help prevent infections. What is cefazolin? Cefazolin is a cephalosporin antibiotic which is used for the treatment of various bacterial infections, including those that are serious or life-threatening. The medication is also used to help patients who are undergoing certain surgery for preventing infections. Cefazolin is available under other brand names, Kefzol and Ancef. What are the benefits and uses of cefazolin? Cefazolin injection is valuable in treating a wide range of bacterial infections and plays a crucial role in preventive medicine. Conditions cefazolin treats. Cefazolin is prescribed for various bacterial infections, including skin and soft tissue infections, bone and joint infections, respiratory tract infections, including pneumonia, urinary tract infections, biliary tract infections, blood infections, bacteremia, heart valve infections, endocarditis, genital infections. Secondary uses of cefazolin. Beyond treating active infections, cefazolin is commonly used as a prophylactic medication to prevent infections in surgical settings. It's frequently administered before, during, and shortly after surgery to reduce the risk of surgical site infections. Additionally, it's used to prevent Group B streptococcal disease around the time of delivery. How does cefazolin work? Cefazolin operates through a bactericidal mechanism that targets the bacterial cell wall. Cefazolin inhibits bacterial cell wall biosynthesis by binding to specific penicillin-binding proteins, PBPs, located inside the bacterial cell wall. This binding prevents the third and last stage of bacterial cell wall synthesis, specifically by inhibiting peptidoglycan synthesis. The drug removes the dealanine from the precursor of the peptidoglycan, which is essential for maintaining cell wall integrity. The disruption of cell wall synthesis, combined with the continued action of bacterial cell wall autolytic enzymes, autolysins, leads to bacterial cell lysis and death. This mechanism is effective against a wide range of bacteria, particularly gram-positive organisms. Cefazolin dosage. Cefazolin is available as an injectable medication that must be administered by healthcare professionals. Typical dosage instructions. Dosage varies based on the type and severity of infection. For mild infections with gram-positive cocci, 250 to 500 mg 4 or IM every 8 hours. For moderate to severe infections, 500 mg to 1 G4 or IM every 6 to 8 hours. For severe, life-threatening infections, 1 to 2 G4 or IM every 6 to 8 hours. For surgical prophylaxis, 1 to 2 G4 30 to 60 minutes before surgery. Cefazolin injection is typically given over approximately 30 minutes when administered intravenously. How to use cefazolin. Cefazolin injection is available as a powder that must be mixed with liquid or as a pre-mixed substance that must be injected intravenously, through a vein, over a 30-minute duration. Injections of cefazolin may also be offered intramuscularly, into a muscle. It's typically given every 6, 8, or 12 hours. The duration of your treatment is determined by the type of infection you have and the body's reaction to the drug. What should I do if I miss a dose of cefazolin? If you miss a scheduled dose, use the missed dose as soon as you remember. However, if it's almost time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not double the dose to make up for a missed one. What happens if an overdose? An overdose of cefazolin is unlikely to cause serious problems but could lead to seizures, trouble breathing, neurological symptoms. In case of overdose, immediately seek emergency medical attention. What are the side effects of cefazolin? Like all medications, cefazolin can cause side effects, though not everyone experiences them. Common side effects. The most frequently reported side effects include itching, white patches in mouth, loss of appetite, heartburn, gas, nausea, vomiting, diarrhea, headache, dizziness, weakness, tiredness, drowsiness. Some of the serious side effects of cefazolin are rash, hives, difficulty while breathing, swelling in legs and feet, dark urine, fainting. The majorities of side effects are minor and will go away as your body responds to the medication. If they don't go away or you're concerned about them, consult with your doctor. Precautions and warnings. Before starting cefazolin, discuss your medical history with your healthcare provider to avoid complications. Exercise caution if you have kidney or liver disease, gastrointestinal disorders, or a history of serious allergies. Who should avoid this medicine? Individuals with known cephalosporin or penicillin allergy. Patients with severe renal impairment, dose adjustments required. Age restrictions. Generally safe in adults and children, pediatric dosing under specialist guidance. Use in neonates requires careful monitoring. Alcohol or food interactions. No significant alcohol interaction, but avoid excessive alcohol to reduce GI upset. Can be taken with or without food, though administration with food may lessen stomach discomfort. Possible interactions with other medications, drug interactions. Cefazolin may interact with other drugs that affect kidney function or compete for active tubular secretion. Always inform your healthcare provider of all prescription medications, over-the-counter drugs, supplements, and herbal products you're taking. Aminoglycosides, increased nephrotoxicity risk. Probenecid may prolong cefazolin levels by reducing renal excretion. Loop diuretics, potential for additive renal effects. How should cefazolin be stored? Proper storage maintains drug potency and reduces safety risks. Keep all forms cefazolin injection, tablets, and capsules out of reach of children and pets. Recommended storage temperature. Store at room temperature, 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. What happens if not stored properly? Exposure to heat, light, or moisture may degrade the active ingredient, reducing effectiveness and potentially causing harm. Discard any cefazolin that has changed color, developed particles, or exceeded its expiration date. Warnings for serious health conditions. 1. Pregnancy. Cefazolin may not be safe to use during pregnancy. Animal tests have shown adverse effects on the developing infant, but there are very limited studies on human. Before prescribing it to you, the doctor can consider the advantages as well as any possible risks. Please seek medical advice. 2. Breastfeeding. It's likely that cefazolin is safe to use when breastfeeding. Based on limited human evidence, the drug appears to have no serious risk to the infant.